Hello and welcome back to the show today. And my name is Kim Nartker and I help people experiencing pain and tightness get to the root cause of the problem in order to fix it long term and successfully. And today I want to help you better understand the causes and treatment options for shoulder pain. Now, shoulder pain and tightness are very common problems that often lead to dysfunctions like rotator cuff tears, labral tears, frozen shoulder, impingement, and so much more. And I found in my Stretch Mobility Coach clinic that shoulder pain and tightness is very treatable if the right treatment is utilized. We can actually decrease damage that commonly occurs in shoulders that leads you directly to surgery. Now, some of the common symptoms that people experience when their shoulder is not working correctly begins with tightness, shoulder pain, neck and upper back tightness. Some people experience poor posture and poor mobility in the cervical spine and in the thoracic spine. Now, the shoulder complex is a group of bones, joints, tendons, and muscles that work to allow normal shoulder mobility. The shoulder is actually a bone and socket joint that's main purpose is to glide normally to allow you to raise your arm up above your head, reach out to your side, reach back behind your back, and functionally allows you to pick up and carry items, pick up things, pick up your kids, and so much more. This joint is stabilized by many muscles that assist with normal shoulder stability and mobility. Now, your shoulder joint is also connected to other bones of the upper body that help you move the shoulder joint so that you can do the task that you want to do. Many people ask me, why does shoulder pain or tightness occur? And guys, there are many reasons why shoulder pain and tightness occurs. But the upper body that I referenced before includes the cervical spine and the thoracic spine, the shoulder complex, the chest, and the ribs. This entire complex works together to assist in normal shoulder mobility. When one of these areas is not moving correctly, your body is going to compensate with muscles and joints to allow you to do the activities that you love. And when these activities are performed repeatedly, compensation goes on too long, then strains, tears, and joint restrictions are going to occur. And guys, this is your body's way of helping you do the things that you want to be able to do. Typical ages shoulder pain and tightness occurs. We typically see young athletes all the way up to seniors experiencing pain and tightness in the shoulder. And most of these populations can get relief from pain and tightness long term so they can avoid tears that actually lead to surgery. Now, here's how you fix shoulder pain and tightness long term. In order to gain complete restoration when you're experiencing pain and tightness in your upper body or your shoulder, you're going to need to find out where your problem is actually coming from. And a comprehensive consultation will be required to determine where the root cause of your problem is so that we can better determine why the shoulder is affected. Now, once your provider has found where the problem is actually coming from, they're going to need to address current signs and symptoms of pain and tightness while they fix the root cause of the problem along the way. Typical long-term treatment for this is dependent on the damage in the shoulder and where your musculoskeletal health and deficits are. Now, this is a complicated process that needs to address the problem area as well as address the compensation that is occurring due to the problem area. For peak musculoskeletal health, you're going to need to address every one of these areas. You're going to need to look at the thoracic spine, cervical spine, the shoulder joint, the scapula, the posterior ribs, and the upper chest joints. Your provider is going to need to improve the mobility in every single joint mentioned above and then provide deep stability for all of those areas. Now, once this is done, they're going to need to improve the communication in the joint, the nervous system, and the muscle to ensure that the communication system is working properly. Most treatments are not effective long term because this system is not completely repaired, and it leads most people down to a system of repeated pain and repeated injuries, and those direct paths after that happen lead you directly to surgeries that could have been avoided. And once all musculoskeletal areas have been addressed and once the communication is working properly again, the skill is then needed from your provider to rebuild the musculoskeletal system. And this requires a comprehensive approach and a deep understanding of the musculoskeletal system. They're going to need to know the nervous system and all about the human body. Most treatments focus on decreasing pain, but never ever get to the root cause, nor do they rebuild the damage and ensure that the communication systems in the body are completely repaired. This process can take a few months, and depending on the damage, can actually take up to a year. Now, that doesn't mean you're going to be painful for a year or you're going to be tight for a year. It's just when you're looking at restoring and rebuilding the health of your musculoskeletal system, that's going to take some time because things have been turned off, and they've been turned off for a long period of time, and we have to turn things back on and rebuild that musculoskeletal system, make sure the joints and the muscles and the nervous system are healthy again. This is going to keep you out of surgery. Now, there are many different treatment options available for people looking for relief from pain associated with shoulder pain and tightness. And when you're seeking care, it's important to ask the right questions so that you don't waste your time and your money on treatments that don't achieve what you want to achieve. Now, when you're seeking care for shoulder pain and tightness, here are a few questions that you can ask your provider to see if the treatment that you're going to receive aligns with what you're looking to achieve. First, I want you to ask if this treatment is going to last and keep you away from returning pain and even surgery. Ask them also, how long can I expect to see results from my pain and tightness, or am I going to be coming back for the rest of my life? Ask them if they have a maintenance program that once you've achieved your goals and your pain and your tightness is completely resolved, how can you continue to maintain good musculoskeletal health? Now, if your provider can't say confidently that they can help you in all of these areas, then seeking care from a stretch mobility coach can answer these questions and will provide you with treatment that is more long-term focused. Here's what I focus my time on right now. I actually teach PTAs to start stretch mobility coach practices all over the U.S. And I provide a comprehensive training program that teaches them so that they can help you achieve full resolution of symptoms from shoulder pain and tightness. I also mentor and develop these stretch mobility coaches and build training programs that will keep you away from avoidable surgeries. My proven program is the stretch method. And if you're looking for long-term results, search for a stretch mobility coach near you. And you can go to www.thestretchmobilitycoach.com/find a coach. Now let's talk about joint restrictions here. I talked about your cervical spine, talked about your thoracic spine, your posterior ribs, your scapula, your upper clavicle, upper shoulder joints, as well as your anterior chest and ribs. And guys, all of those areas have bones that connect, and when two bones connect, that is actually a joint. And we look at each of those areas as a stretch mobility coach to see if there are any joint restrictions that limit your mobility that lead to the cause of shoulder dysfunctions, pain, and tightness. Now, when a joint is not mobile and when it is not strong, and you got to know that cervical spine, thoracic spine, the shoulder area, the upper chest area, and the rib area, there are a lot of joints in between there. So when something is not working right and you're not able to lift your arm, it's not just that your arm is affected. There are many components that are affected and not working right. So you need to make sure that you find where the problems are so that you can restore all of those problems that will lead to now taking the pressure off of your shoulders. So this compensation that occurs because there are joint restrictions will lead you at risk for injuries like labral tears, rotator cuff tears, frozen shoulder, shoulder weakness, shoulder pain, and more. And when a joint is restricted, and a restriction to us is it's tight or it's locked up or it lacks the normal mobility required to function correctly, this dysfunction can cause compensation to occur in the upper body. When you move the shoulder repeatedly and the joint and muscle are not functioning correctly, this is going to lead to damage and tears, but also going to advance arthritic changes and lead to degeneration. So for example, when your joints in your neck or your thoracic spine are restricted or they're weak, and you play pickleball, volleyball, tennis, or swim, or any other fun sport out there that requires your shoulder to be moving repeatedly, you're going to start feeling pain and tightness either during your sport or after your sport. And this is actually the first message from your body that something is not working right in your upper body. So when you continue these fun sports without seeking care or finding the problem, you can actually cause irreversible damage to your shoulder. Now, How do you know what treatment is going to work for you when you have shoulder pain and tightness? Well, if you're experiencing any pain or tightness in your shoulder during your sport or after your sport, or even at rest, and your game is declining, or you can't lift your arm, or you can't do the things that you feel like you should be able to do without fear, then your first course of relief is to be able to find a provider that will look at your entire upper body. Now, you can go to the doctor. The doctor can run tests to see if you have a degenerative condition such as arthritis, degenerative disc disease, or stenosis, and they can also rule out other more serious problems. Now, after testing comes back and there is nothing wrong, that is actually a good sign. It's good news because you're clear to seek care from a provider that's skilled in prevention and restoring your strength in your musculoskeletal system. Let's dive into this a little bit deeper. Most people that suffer from shoulder pain have problems in their thoracic spine and cervical joints. Most of them have poor posture and they're starting to cave forward. And once you've seen your doctor and he or she has run all of the tests to see that your problem is not more serious, he or she is most likely going to send you to a physical therapist when you're diagnosed with shoulder pain. And the physical therapist is going to perform an evaluation and develop a program that is covered by your insurance company. The focus of this care is going to be to decrease your pain and take the pressure off any nerves that are causing any numbness as soon as possible. Now, if you attend that physical therapy and you do not see long-term results that you are looking for and you don't want to have surgery, you want to return your upper body to full function so that you can play your sport for life, then you're going to need to seek care from a stretch mobility coach. A stretch mobility coach can pick up where your physical therapy ended and provide you with a program that focuses on non-surgical, natural treatment that will restore joint mobility in your upper body. It's going to then focus on rebuilding strength to support repetitive movements based on what sport you prefer. And guys, if you don't prefer a sport and you just want to pick up your grandchild, we can do that too. Many stretch mobility coaches can also provide you with regenerative modalities that actually heal damage. In fact, the faster that you can improve joint mobility of the thoracic, cervical, and shoulder joints to their normal mobility while working to re-establish deep stability of those areas, the better chances of fixing the pain long term so that you can start enjoying your sport again no matter what your age. Now, some more prevention tips that can help you are to maintain normal, healthy joint mobility throughout your entire body. Maintain healthy muscle strength and flexibility. Eat foods that cause less inflammation. Make sure you get good enough sleep for your body, and I know that's a struggle for many of us, but make sure that you start getting on a routine so that you can sleep better, because that's when healing occurs. Work on your cardiovascular system. Strengthen your musculoskeletal system and be consistent with mindfulness and relaxation, and quiet your mind as much as possible. Decrease stress by being authentic when you can, and then deep thermal laser can actually regenerate and heal the cell around the shoulder area as well as the thoracic and cervical regions, and it will help decrease any nerve sensitivity or numbness if you do experience that. And we're going to work on that in your program as a stretch mobility coach while regaining joint mobility and strength. Proven ways to relieve shoulder pain and tightness naturally for good are you need to break the muscle deconditioning cycle, and that cycle is your injury re-injury cycle that causes further joint damage and muscle weakness and then leads to muscle wasting and deterioration. The stretch method has developed a proven process that takes a client who is experiencing pain and tightness through a successful program that relieves the pain and tightness for good. This treatment focuses on finding why the pain or tightness is happening. And a stretch mobility coach will develop a program based on your signs and symptoms and current joint, nerve, and muscle deterioration, and they're going to do that at your consultation. Then they're going to work with you until your joints, muscles, and nerves have been restored to their full potential. Now, once this occurs, your stretch mobility coach will recommend a maintenance program that focuses care on keeping your joints, your muscles, and your nervous system at its peak so that you can always stay away from surgery and stop the effects of advanced arthritis. Now, a stretch mobility coach is a certified in the stretch method, and it's typically a PT or PTA that can apply to train to work as a stretch mobility coach, given that they have graduated from an accredited school and they hold a current license in their state. Now, the Stretch Method is a post-degree training program that places the healing back into skilled hands so that they can provide you with more natural long-term relief. Now, how can you find a stretch mobility coach? The Stretch Method training program is currently taking coaches across the U.S., and a current listing of active apprentices are found at www.thestretchmobilitycoach.com/find a coach, and I'll put that below this video so that you'll have access to that. And if we don't have a coach near you, you can actually request a coach in your area. Now guys, thank you so much for joining me today. I hope this was helpful for you and it helps you to better understand your shoulder, where your shoulder pain and tightness is coming from, and how you can seek care that will align with what you're looking for. Thanks again so much, and I can't wait to see you the next time.